Sue O'Shea. I'm one of the midwives who works in birthing unit, and I'm going to talk to you today about birth complications and interventions. Sometimes during birth, things don't always go according to plan, and there may need to be some kind of assisted birth. This is sometimes because the baby is getting tired and distressed, or no matter how hard the mum is working and pushing, she may need some help. Or there may be some circumstances that may need the baby to be born quickly. The first is called a ventouse or vacuum. It's a suction device that is placed at the back of the baby's head. Using the force of the contraction, mum's effort in pushing, and the guidance of the vacuum, the baby is born. The choice of either ventouse or the other choice is forceps may need to be used. Each forceps is placed into the vagina one at a time on either side of the baby's head and cheek. With the force of the contraction and also the push by mum, the baby is gently eased out. Now this may require an episiotomy, and that is only usually done with the obstetrician talking to the mum about the need to do so. This is not a procedure which is routinely done. This is a cut in the perineum when the head is crowning, and that's to allow for more room for the baby to be born. However, if all does not go to plan, then there may be the need for a caesarean section to safely deliver your baby. With caesarean section, they can either be elective or emergency caesarean. Caesarean section, called an elective caesarean section, is routine and is booked in at a time that is safe for your baby to be delivered. However, if it is an emergency caesarean, this is only called emergency because it is a non-scheduled caesarean section, and it is the safest mode at that particular time for your baby to be born. So at this stage for an emergency caesarean section, it may be because your baby is distressed during labour, or dilatation may not have happened no matter how long you've been in labour or induction of labour, it is just not dilating. And occasionally, all efforts to push just don't result in a vaginal birth. The most important thing though, and the factor out of your birth, is that you have a safe outcome for both yourself and your baby. It is always important and helpful to you if you have an emergency caesarean section to at a later time have a discussion with your midwife and your obstetrician, just so that you may understand the reasons why this was the mode of delivery.